At its birth, the Kenyan nation had a population of 3,450,000 people. In the first 2 decades after independence, the country experienced a rapid increase in fertility and a substantial decline in death rates, resulting in increased population growth. In response to this rapid rise in population, Kenya became the first sub-Saharan African country to launch a national family planning program in 1967. Its immediate aims included promoting the health of the Kenyan people and the country's economic development.
When we are talking about government policy on reproductive health, we are focusing on policies related to safe motherhood and child survival. We focus on policies focusing on family planning, focusing on empowering the youth and adolescents on reproductive health. We focus on STI, HIV, AIDS diseases, infertility issues, gender and reproductive health, and health focusing on the elderly.
Reproductive health can be defined as a state of well-being related to one's sexual and reproductive life. It implies that people are able to have a satisfying and safe sex life and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. Reproductive health plays a vital role in national well-being and development. The government of Kenya, recognizing the importance of reproductive health to national life, has placed great emphasis on it and initiated a wide variety of programs and projects in various parts of the country.
We have special programs at the facility level where our staff teach our people about family planning. We also provide commodities which the people, both females and male, can use to ensure that issues related to reproductive health are taken care of.
The Division of Reproductive Health, based at the Ministry of Health, plans, implements and monitors programs to promote the reproductive health of the Kenyan people. Its goal is to ensure provision of a comprehensive, integrated system of reproductive health care through a range of services offered by the government, non-governmental organizations and the private sector.
The Reproductive Health Division is actually one of the divisions of the Ministry of Health within the Department of Preventive and Promotive Health Services. It's always been there as part of health because you see issues around maternal and child health are really core to delivery of health care.
For decades, women seeking reproductive health services in Kenya suffered serious human rights violations, including physical and verbal abuse and detention in health facilities for inability to pay. However, this situation has since changed.
Recently, the government put in a policy which says that all mothers who go to our facilities, health centers and dispensaries deliver for free.
As Kenya continues to grow socio-economically and in terms of population, so has the demand for reproductive health services. This phenomenon has created both challenges and opportunities.
If you look at the trends in this country, we started off well in the 70s and 60s, especially around the program of family planning. When we came to the 80s and 90s, and of course the 2000, early 2000, there was a general reversal of all the health indicators.
A critical element in reproductive health is information and how it is kept and transferred. It is important to build knowledge and a database over the years that will serve as a reference point for use by government workers, health professionals, researchers, individuals and organizations for future use.
Most of our people suffer and they get health ailments because they don't have proper information about their health. So we want them to have proper information so that they change their behavior towards health-seeking behavior.
The Division of Reproductive Health, in collaboration with its development partners, continues its work to improve maternal and child health by advocating for safe motherhood, building capacity for health service staff, and improving service delivery and provision of supplies and equipment. One such partner is the German Technical Corporation, GTZ.
The entire German support, and you can see GTZ without KfW, who is providing a major part of contraceptives to this country. We know that between 2008 and 2010, for 3 years, the German government has committed about 33 million euro to support reproductive health and to support health financing so that poor people have better access to health services in this country.
Safe motherhood entails access to adequate prenatal, maternity and postnatal care for every woman.
We have other areas of reproductive health, like safe motherhood. We are talking of delivery services. There are newer things coming up on how to manage pregnant women. So resources to update our health workers, resources to improve the labor wards and the theatres to offer those services.
The programs and projects covering the various aspects of reproductive health under the Kenya government's Ministry of Health are now spread throughout the country, from the shores of Lake Victoria in the west through the Rift Valley and the highlands of central Kenya to the arid northeastern province. Just north of Mombasa is Malindi. Poor women who live away from the town give birth in domestic settings. Without good knowledge on reproductive health, women and their babies are exposed to danger. Among the strategies initiated by the Division of Reproductive Health to address the issue is the maternal shelters.
A shelter is a place whereby we provide facilities like a hostel where a mother comes 2 weeks before delivery at gestation 36 weeks. And basically these are not all mothers, but they are mothers or pregnant women who are at high risk. And apart from that, mothers who come from remote areas where accessing a healthcare facility is a problem.
Ila niko na daktari wa huku kwetu wa adu. Kwa nije hapa nikuja huku kwa sababu ya shida yangu. Nimeambiwa kuonekana afadhali kutulia maana niko na shida ya pressure.
Prolonged labor and delays in reaching health facilities often leads to life-threatening complications during childbirth, one of them being obstetric fistula.
When we talk of fistula in obstetrics and gynecology, we basically have two kinds of fistula. We have a fistula that communicates with the birth canal, communicates to the system that collects urine, and the one that communicates between the birth canal and the one that and the stool passage. In both situations, we have urine leaking from the bladder into the vagina, or from the ureters into the vagina. Stool can also leak from the rectum into the vagina. And basically what that means is the patient has no control on her functions.
The Moi Teaching and Referral Hospital in Eldoret, a part of Moi University, caters for a large part of the vast Rift Valley province. In this large and modern health facility, various complications related to reproductive health are treated. One of them is obstetric fistula.
We have about 90% of the patients actually come here because of fistulas which are related to delivery, surrounding delivery. So these are patients who for one reason or another, did not receive the care that they are supposed to get, either because there is delay. We can have delays that occur because this patient does not come to the health facilities. So there's a delay in the community. The other delay is really once the decision has been made to get to hospital, there's no transport. It happens at night, there's no transport, so this patient reaches to hospital even as late as a day after labor has started.
Moiben is an arable area situated in the highlands of the Rift Valley. Chebet Corona, a mother of one, lives here. She suffered from obstetric fistula and was admitted to the Moi Referral and Teaching Hospital for reconstructive surgery.
Nilikuwa mjamzito miaka 10 zilizopita, alafu ikakuwa muda mrefu nikakaa nyumbani nikiumwa, alafu baadaye nikaenda hospitali, ikawa nimechelewa kuzaa. So mtoto akawa amekufa kwa tumbo, nikafanyiwa upasuaji. Katika ile hali ya upasuaji, baadaye nikakuwa na shida ya makocho. So imekuwa ikitoka kwa muda ya miaka 10, na niliposikia hii wito kwamba kuna madaktari ambao wametembea Moi Referral Eldoret, nikapata kwenda mahali pale na nikapata matibabu, nikaweza kupasuliwa tena mara ya pili na dischargiwa. Sasa nasikia vizuri.
Thika is an industrial town just 30 kilometers north of Nairobi. Not long ago, the district hospital faced many operational challenges. As a result of adopting best practices recommended by the Division of Reproductive Health, there has been a turnaround in terms of service delivery, which has led to the community adopting good health-seeking behavior.
This is a high-volume district hospital whereby we get quite a number of clients, basically. And like in the maternity unit, where we have about 46 bed capacity, in a month we get about over 700 deliveries. Out of these, we get about, in a day, we get about 20 normal deliveries. Well, we get about between 7 and 10 cesarean sections.
Best practices can be defined as a practice or program that has substantial evidence of impact or which has successfully met its program objectives. A best practice must show evidence that it has been transferred or replicated in various settings. The result of the best practice adopted by the hospital are evident from the number of clients seeking services at this facility.
From what we have got from the clients who have come to us, like the ones who come from Nairobi, there are some who even come from Kiambu. They tell us that our services are good and also they are affordable. Because you find like in Nairobi, there are clients who have attended Pumwani Hospital or other hospitals for the antenatal care, but during the delivery they come here.
In Garissa, the provincial capital of the northeastern province, maternal health comes into sharp focus through the experiences of the community and the local health workers. Today, the monthly maternal death review meeting is being held.
Wamezaa vizuri, wamerudi nyumbani. Wale wamezaa nyumbani, wawili wamekosa damu, wamepunguliwa na damu.
Okay.
These reviews are crucial in determining the circumstances surrounding maternal deaths and in effect equip the division to apply effective intervention. For some of the mothers, like Sarah Abdi, the reproductive health services at the Garissa hospital can mean the difference between life and death. Quick action by the community health worker saved her from imminent death. The situation in this arid area is aggravated by the fact that maternal mortality is much higher than in other parts of the country.
Maternal mortality in this region is very high compared to the rest of Kenya. In fact, we have the national figure of 414 per 100,000 live births, while in this region it is ranging between 1,000 and 1,300 for every 100,000 live births, mainly as a result of poverty, as a result of illiteracy and some of the cultural practices around.
In many remote areas, many births are attended to by professional midwives who have over the years mastered the science of safe motherhood using the most basic tools and extensive knowledge. They play an important role as far as achieving a reduction in the rates of maternal and baby deaths.
Kazi yetu ni kutembea vijijini kueleza wamama umuhimu wa kujifungulia kwa hospitali na tena kama sio hospitali kujifungulia nyumbani, lakini awe ni mama ambaye mtu ambaye anamhudumia ni mtu ambaye amehitimu.
In Mount Elgon area, families are traditionally large and frequent pregnancies often impact negatively on the health of the mothers. Many of the deliveries occur at home.
Familia yangu ni watoto 7, nina vijana 4, wasichana 3. Na mkubwa ako standard 7. Ni mtoto wa mwaka 91. Mara mingi nimekuwa nasaidiwa na Dr. Wycliffe Tekwe na sua sana kwa msiko huu ambao mdogo niko naye mguuni pangu. Niliweza kuingia kule clinic, hali haikuweza kujulikana kwamba ni wako namna gani.
The midwife as a health practitioner is critical as far as reproductive health is concerned.
There were so many mothers who were delivering at home. They were being delivered by unskilled personnel. We call them the traditional birth attendants at our place here.
With better information and capacity building from the Division of Reproductive Health, midwives continue to play an important role in improving the standard of healthcare provided to mothers and their babies at community level.
The ministry thought about of how we're going to help the mothers in the village. And so there are some nurses who had retired from the ministry. So they were retrained and it was rolled down back in Cheptais in the year 2004.
Reproductive health often involves the use of contraceptives as a means of family planning. At Runyenjes in Embu district, the community has learned about the benefits of family planning and the judicious use of contraceptives from the community-based distributors, popularly known as CBDs.
Kazi yetu sio tu kupeana ndawa peke yake uko kule tumetoka, lakini still sisi tunaendelea na kufundisha tu wakina mama. Tunawafundisha mambo ya family planning na zile njia ambazo zinaweza kuwasaidia kwa ajili ya upangaji wa uzazi.
In the lush highlands of Nyanza province in the west of Kenya is Kisii. Division of Reproductive Health is engaged in promoting new ideas at community level by supporting provincial and district health workers. Today, the district team is discussing new techniques in family planning with special focus on the use of the IUCD method.
the staffs in this center, and especially the healthcare providers as the nurses, they are very positive because they take their time and do counseling. They counsel the clients, and actually after they have counseled the clients, they allow them to make their own informed choices.
Margaret is a beneficiary of this initiative, and though she had initial reservations about this method, she now appreciates the advantages of using modern family planning methods.
Mimi nimetumia hiyo method ya kweli. Kwanza kabisa nilikuwa natumia sindano, nikadungwa sindano wakati wa kwanza. Hapo katikati wakati nilistahili kurudi, pesa ikanikosa ya kurudi ya sindano. Alafu nikaona ni afadhali nitafute njia nyingine yenye inaweza nisaidia wakati wowote. Hakuna wakati maybe nitasumbuka sina pesa, ama wakati mwingine mzee amekuja hapo katikati hakuna pesa. Kutoka wakati nimewekewa siku ya kwanza inaweza dumu kwa mwili kwa miaka 12. Kutoka huo wakati sijakuwa na shida yote.
Despite the wrong perception that family planning is a reserve of the women folk, more and more men have come to appreciate the benefits of family planning methods.
Kila wakati sister mmoja alikuja akatuelezea na nikamwambia jaribu. Na mwanzo nilikuwa na haraka watoto wawili. Na wakati mama alikuja akaelezewa tukakubali, akakuja akawekewa. Kwa hivyo kuanzia hapo alipoanza kutumia hiyo mpaka sasa naona ako sawa, hata kazi anafanya vizuri, hata kuzaa sasa naona ni vizuri, hata nikamaliza miaka 4 alafu nikapata mtoto mwingine.
Teenage sex and pregnancies have become a major challenge.
It is likely to get a mother as young as 14 years, 15, 16, and during this period, and sometimes even 12. And during this time, this woman's body, this girl's body, I will say a girl, has not fully developed and is not prepared obstetrically to really bear a child.
Pregnancies among teenage girls often lead to stoppage of education and early marriages. Rehema Riziki is 16. She got pregnant 2 years ago and had to cut short her schooling to bring up her daughter Kashi.
Patamba nilipokuwa nasoma na nilipoenda kwa daktari ndo akanieleza jinsi ya kwa nikiwa na mimba nitakuwa na hali fulani. Sasa aliponieleza nilipojifungua sasa nikampeleka kwa clinic. Sasa akanielezea kwa kuna vyakula fulani vya kwa nitampa mtoto na siku fulani siku za clinic akiniandikiwa niwe nikiattend vizuri nimpeleke mtoto akipata chanjo.
For both the girls and the young men who enter into early marriage arrangements, difficulties abound, but life must go on. Counseling on family life is an important part of the reproductive health program.
Mimi kwa siku za usoni vile ningependa hasa pengine kwa wakati mwingine pengine hata kama nikupata mtoto, lakini bado kwanza sababu kwa tutaka kama huyo ambaye ni Kashi sio au atasoma vizuri na atakuwa ni paka yatembea vizuri
Nakuru, situated right in the center of Kenya within the Rift Valley province, is the home of a very successful youth-friendly center supported by the Division of Reproductive Health.
Young people in Nakuru have problems ranging from teenage pregnancy, drug and substance abuse, and safe abortions. We have a lot of problems of early and unintended marriages. We have problems of female genital mutilation and many other harmful traditional practices that affect the young people.
winning the confidence of the youth is key to the division's adolescent health strategy. The center is thus manned by youthful staff who relate well with the young clients.
A youth comes into a clinic, probably for something like family planning. The counselor is allowed to attend to that youth so that by giving them that special attention, the youth will feel like they are part of that facility.
Realizing the benefits of remaining in control, the youth have embraced this initiative and can now appreciate the fact that risky behavior can completely ruin their goals and life dreams.
I came today to get counseling on an issue that I had. The issue I had was an issue related to drugs. This is my third visit, and we were still continuing with the sessions. I would say that it was received very well, and the issue that I had was addressed quite effectively.
I think they qualify to what they're doing because they're doing it perfectly. Yeah, they were encouraging, caring, and no discrimination.
It all started as a strategy. The ideas are now in the implementation stage. Monitoring is continuous. The results are encouraging, and the team at the Division of Reproductive Health braces for even greater tasks, ensuring that the whole process is not reversed.
Our strategic plan now involves stakeholders, and at district level where most of the services are given, we have a district stakeholders forum where we have our partners, whether be they in government, be they NGOs, be they faith-based organizations. They all work together with the district medical officer of health.
The Millennium Development Goals focus the efforts of the world community on achieving significant, measurable improvements in people's lives and establishing yardsticks for measuring results. Universal access to education and reproductive health care are crucial steps that can help to eradicate poverty.
Reproductive health strategies have been helping to change the picture, and we feel that the adolescent sexual reproductive health strategy of the government is doing the right things, and this is why we're supporting it.
The Division of Reproductive Health has turned around attitudes among reproductive health workers by proving that it is possible to deliver quality service if the goal is to help every woman.
The government has invested its own money in family planning commodities. As we speak this financial year, the government has put in more than 400 million for contraceptives. This is up from actually almost no contribution to family planning commodities.
It's all about people, who are a nation's most important asset. Creating a reproductive healthcare program that delivers top-quality service is equal to investing in an asset that will eventually serve the nation better because it is in good health. Above all, reproductive healthcare has also adopted a human face, caring, listening, understanding, and sensitive to each client's needs. This is the new paradigm in public service. The Division of Reproductive Health is proud to be setting high standards and in the process seeing a healthier population all round.